Hi, I'm Wanda Wright. I'm the director for the Arizona Department of Veterans Services. I was in the military service for over 26 years. I spent 5 years in active duty and another 21 years in the Arizona National Guard. I come from 3 generations of those who served in the military, and I am proud of being part of the legacy of serving our country. Today, I want to talk with you about our organization and some observations and concerns programming of our department around mental health. The Arizona Department of Veterans Services is a state agency that serves and provides advocacy to service members, veterans, and their families. Our mission is to be the catalyst and response to the evolving needs of Arizona's veterans and their families. ADVS provides direct services to the veteran community through veteran benefit counselors, Arizona Veterans Memorial Cemeteries, Arizona State Veteran Homes, and other statewide programs designed to aid veterans. Bottom line, we want to remove any access barriers to services and benefits all veterans have earned through their service. Veterans make up almost 11% of our population, ranking Arizona among the top 15 states with the highest concentration of veterans. More than 500,000 veterans call Arizona home, which include 397,000 wartime veterans, 56,000 military retirees, 100,000 veterans that receive disability compensation, and nearly 6,000 veterans receiving a pension. Note that most of our veterans are over the age of 65. While most Arizona veterans are men, we estimate about 50,000 women veterans live across the state. Here in Maricopa County, we have the second largest number of Vietnam veterans in the United States. I will discuss more on this later in the presentation. We also serve Arizona's service members. We are home to approximately 20,000 active service members that reside in 5 military installations: Davis-Monthan Air Force Base in Tucson, Fort Huachuca and Sierra Vista, Luke Air Force Base in Glendale, Marine Corps Air Station in Yuma, and Army Proving Ground in Yuma. Arizona also has over 15,000 National Guardsmen and reservists. Now I want to share a few of the services that the Arizona Department of Veterans Services has to offer. We'll start with our Arizona State Veteran Homes. They are skilled nursing facilities that serve the long-term care and rehabilitative needs of veterans with energetic and caring staff who provide nursing, therapeutic recreation, social services, and rehabilitative physical, occupational, and speech therapy. These homes allow our residents to enjoy an independent lifestyle with services customized to fit their needs. We have 4 locations, Phoenix and Tucson, which are fully operational, and 2 homes nearing completion in Yuma and Flagstaff. Our Phoenix facility is a 200-bed facility located between the Carl T. Hayden Veterans Administrative Medical Center and Steele Indian School Park. Our Tucson home is similar, located next to the Southern Arizona VA Healthcare System Hospital. This 120-bed facility offers many amenities, including private rooms and full baths, providing a home-like environment. Arizona State Veteran Home Yuma is currently accepting applications for residents and is set to welcome them in October. Our Flagstaff home is tentatively scheduled to open with residents in the spring of 2023. We will eventually hire 125 employees to staff each home, which includes registered nurses, licensed practical nurses, dietitians and aides, housekeeping, and administrative services. Next is our Veteran Benefits Counselors, or VBCs. VBCs are accredited by the U.S. Department of Veteran Affairs and advocates for Arizona's service members, veterans, and their families in their pursuit of the federal and state veteran benefits they are entitled to. VBCs ensure Arizona veterans receive over $60 million a month in VA benefits. They also assist claimants by educating them on eligibility requirements for benefits, processing VA compensation and pension applications, appealing VA decisions, representing claimants at VA hearings, filing for survivors' benefits, referring claimants to other agencies for potential benefits, requesting military service records, and certifying DD-214s, which is discharge paperwork, and discussing state veteran benefits. Our virtual VBC program allows VBCs to see clients through online appointments. This reduces travel time for clients and VBCs, and reduces time veterans have to wait to see a VBC. Then there are our Arizona Veteran Memorial Cemeteries, which provide a lasting final benefit in honor of veterans and their families with a final resting place in appreciation and gratitude for their service and sacrifice to our nation. Cemeteries offer burials to all eligible members of the armed forces. For a fee, the veteran's spouse and qualifying dependents are also eligible. We operate 3 locations: Sierra Vista, Marana, and Belmont near Camp Navajo. Veterans and their dependents can check their eligibility and pre-registration for services at their cemetery of choice. The Arizona State Approving Agency, or SAA, is responsible for reviewing, evaluating, and approving quality programs of education and training under state and federal criteria. The SAA works with educational partners to fulfill its mission to promote and safeguard quality education and training programs for veterans. It also ensures greater educational training opportunities to meet the changing needs of our veterans. Assist the VA in preventing fraud, waste, and abuse in the administration of the GI Bill. Currently, Arizona has more than 17,000 GI Bill users, and the SAA has approved over 400 institutions to accept their GI Bill benefits. ADVS also has programs and initiatives and works with several organizational partners to help support veterans. The Arizona Military Family Relief Fund provides financial assistance to families of currently deployed service members, as well as military and veteran families for hardship caused by military service. For separated service members, this could also include hardships caused by service-connected disabilities. Service members and veterans discharged under honorable conditions who meet all of the following criteria may be eligible for financial assistance. Deployment by the service member or veteran. Deployment includes any movement from a military service member's home station to somewhere outside the continental U.S. and its territories. Arizona residency. One of the following must apply. The service member or veteran claimed Arizona as home of record, or was a member of Arizona National Guard at time of deployment, or was deployed from an Arizona military installation. Financial hardship. One of the following must apply. For veterans, they must demonstrate that military service caused their current financial hardship. For family members of a service member, they must demonstrate that the financial hardship is due to the service member's current deployment. For surviving families, the service member or veteran died or was wounded in the line of duty, and the family needs financial assistance with travel and living expenses. If a widow, widower, or dependent child of a deceased service member is applying for financial assistance, the service member must have died in the line of duty, in a combat zone, or a zone where the person was receiving hazardous duty pay. Our Veteran Toolkit program funds expenses associated with beginning employment for veterans. For example, if a veteran is getting a job in the medical field and needs scrubs before they start, we will buy the scrubs to make sure there are no barriers standing between them and their new job. Qualifying veterans must live in Arizona, have a job offer, and be in need of tangible items to support employment. Visit any Arizona at Work office to apply. The Arizona Veterans Donation Fund assists programs and initiatives that benefit veterans and their families. The VDF supports Arizona's veteran community through small grants up to $4,999 and large grants between $5,000 and $75,000. More than $1 million is granted yearly to support the veteran community. Funds come from tax-deductible charitable donations and the purchasing of veteran, women veteran, or Freedom Arizona license plates. You can purchase veteran plates at servicearizona.com. So how does the Arizona Department of Veterans Services support the military and veteran community when it comes to mental health? First, it's important to understand the data around veterans and mental health. According to the National Institute of Mental Health, more than 1.7 million veterans receive treatment in a VA mental health specialty program. A study from the VA Palo Alto Healthcare System and Stanford University found that veterans were no more likely than non-veterans to have depression or anxiety. The team had expected to see higher rates because veterans, especially those who served in combat, generally experience more stress and trauma than non-veterans. They found that 11% of veterans reported elevated rates of depression, and 9.9% of veterans reported elevated levels of anxiety. However, Vietnam veterans were twice as likely to have elevated depression and anxiety compared with World War II or Korean War veterans. And if you recall from an earlier slide about our veteran population, more than half of Arizona veterans are over 65 years old. The research also suggests that anxiety sensitivity may link PTSD and suicide risk. Anxiety sensitivity is an exaggerated fear of experiencing symptoms related to anxiety and is separate from the actual symptoms. Researchers at the Southeast Louisiana Veterans Healthcare System found a significant association between the severity of PTSD in male veterans and a greater frequency of suicidal thoughts, plans, and impulses. They also found that when people with PTSD worry that their personalities have changed or that they are not thinking normally, they may be at increased risk of suicidal behavior. Scientists also found that 5.6% of more than 300,000 veterans who were referred to anxiety or PTSD clinics experienced homelessness. Estimates suggest that nearly 4% of the veteran population has been or is homeless. And veterans who were unmarried or diagnosed with a drug use disorder were more than twice as likely to become homeless. I will discuss how ADVS is tackling the issue of Arizona veterans experiencing homelessness a little later. One of the biggest obstacles that veterans and service members experience to getting their services and benefits is the stigma they face. Military personnel face challenges during their tour of duty that can make it difficult to readjust to life back home. Many service members returning from duty in Afghanistan or Iraq experience symptoms of psychological distress, including PTSD. Other issues include stress, mood, anxiety, sleep, psychotic, and addictive disorders. Fewer than 50% of returning veterans in need receive any mental health treatment. Officials estimate that approximately 17 veterans die by suicide every day. The National Institute of Drug Abuse reports that between 37 and 50% of veterans returning from Afghanistan and Iraq have been diagnosed with a mental disorder associated with substance abuse disorders, and that 63% of those diagnosed with substance use disorder also met criteria for post-traumatic stress disorder. There's a need for mental health treatment, but the National Suicide Prevention Annual Report says less than 50% of veterans seek support. Now that we have a better understanding about the mental health issues affecting veterans, what is ADVS going to do to support them? We recognize the correlation between mental health and housing and homelessness. We take seriously the challenge of assisting homeless veterans to find safe shelter where possible. In 2010, we began the Arizona Action Plan to end homelessness among veterans. ADVS and the Arizona Housing Coalition collaborate to institute 3 key goals and 26 regionalized objectives to sustain efforts to end homelessness among veterans in Arizona. As of August 2022, our by name list shows 1,067 homeless veterans in Arizona. So what are our action plan goals? We want to end street and shelter homelessness among veterans. Our strategy is to increase the coordination of resources for veterans living on the streets or in emergency shelters through the development of critical response units. We want to transform the temporary help system. We will coordinate a plan for grant and per diem programs to adopt new models of care with the capacity of ending street and shelter homelessness. We want to ensure ongoing system functionality for all veterans experiencing homelessness. We ensure statewide systems for veterans experiencing housing instability include prevention with a balance of affordable housing and supported housing. ADVS also assists in funding stand-down events hosted by the Arizona Veterans Stand Down Alliance. Stand-downs provide benefits and services to thousands of veterans a year. The Be Connected program is a statewide effort to strengthen access to support and resources for the more than 500,000 service members, veterans, and their families who call Arizona home. The program focuses on connecting veterans to the services they need early enough to prevent them from feeling isolated and having suicidal ideations. Why? The risk of suicide is 3 times higher among Arizona veterans. The risk of suicide is 4 times higher among our older Arizona veterans. For every 1 suicide, 227 people report thoughts of suicide. Here are the top reasons people use Be Connected: financial assistance, VA benefits, behavioral health, permanent housing, a veteran, family member, or someone in the community can call the support line for assistance connecting to a resource. Match. Be Connected employs statewide resource navigators that offer personalized help connecting to resources. There's also an online tool to match people with the resources they need. Learn. Be Connected provides in-person and online training so everyone can gain the knowledge and skills to help. Anyone can access Be Connected at beconnectedaz.org or by calling 1-866-4-AZ-VETS. We have a new initiative called the Be Connected Community Corps. Some of our latest initiatives include developing a statewide volunteer network to support the Veteran Transportation Program that will assist veterans by meeting transportation needs for VA appointments. It will also have the Veteran Relocation Program that will provide mover assistance from one location in the state to another within specified limits for veterans who have been evicted or otherwise displaced from their home and required rapid relocation. Lastly, it will support the expiration term of Service Sponsorship Program, a national VA and DoD initiative that provides members of the armed forces who are completing their military service with a sponsor within the community to which they have chosen to either relocate or remain and call home. Be Connected is Arizona's resource to provide that service. Our newest initiative is Heroes Pathway to Hope. This is a collaborative effort between ADVS, the VA, Be Connected, and the Arizona Housing Coalition. Heroes Pathway to Hope aims to help the needs of the most vulnerable homeless veterans requiring a higher level of care, who are otherwise unable to access a shelter due to complex care needs. This is a gap within the existing veteran homeless response system statewide. Veterans who meet this definition are commonly experiencing serious mental illness, cognitive dysfunction, or physical disability that results in the veteran being considered incapable of taking care of their own basic needs. There is no single immediate solution for veterans in this situation, and the VA has struggled to secure reliable options, often having to utilize VA hospital emergency rooms as an interim solution. Heroes Pathway to Hope provides a unique opportunity to bridge these veterans in assisted living facilities, skilled nursing facilities, group homes, and board and care facilities. Veterans in this situation often resolve in time with VA support to secure benefits, including aid and attendance, and health care services such as Access Services or the Arizona Long-Term Care System. Applications processing time can take between 45 days to 2 months or longer depending on case complexity. An upcoming project we're working on is our Tribal Connectivity Project. This project comes from our outreach and partnership with Arizona's reservations. Our tribal partners reported that with increased access to technology, they could better serve their veterans who have had barriers to service and support. Through a partnership with the Arizona Department of Health Services, we will offer laptops, tablets, and internet capability to the tribes. They will use the technology for things like mental health appointments, benefit counseling, doctor appointments, resource navigation, and other services aimed at reducing social isolation and loneliness. If you have any questions or comments for me and our team, feel free to email me at director@azdvs.gov or call us at 602-255-3373. I appreciate your time and attention this morning. We can do great things for veterans. Thank you.
Well, that was a very good presentation that was recorded, and I just wanted to let you know that we have a couple of people from Dr. Colonel Wanda Wright's office that can field any questions and also can talk more about any of the topics that were presented. We have Nicole Baker, who is the Assistant Deputy Director of Public and Intergovernmental Affairs, and Jennifer Harris, the Legislative Liaison. Um, Jennifer and Nicole will be able to answer any questions. Just put them in the chat. So there are a couple of questions for Nicole and Jennifer. The topic of the presentation was technology applications in rural communities. And I think that what was presented in the final slide around the tribal connectivity slide, that that was that was part of this initiative. Is there anything else that you can talk about in terms of some of the technology applications in rural communities?
Good morning. Yes, so part of the thing that Colonel Wright talked about earlier was our veteran benefits counselors. And one thing that we really noticed early on was that we could utilize them better throughout the state. So originally we had them all in like brick and mortar type of offices. And so we started making the switch a couple of years ago to kind of make them hybrid between using online appointments, phone appointments, and then still having some in-person offices. And so what we found with that was that that specifically helped our rural populations because we didn't have to worry about them saying, you know, I have to go 2-3 hours in order to get to one of those brick and mortar offices. Instead, they were able to see someone, you know, if not in their home, somewhere really close. So what we started doing was promoting the use of online technology in order to connect them with those appointments. And when they had those benefits appointments, you know, they're talking to people about their claims. Sometimes it's a quick question, but all sorts of things that we were able to do that we weren't able to before when we had the brick and mortar offices. And so it specifically helped our role in aging population because we were able to say, you know, if you can at least, you know, access a phone, we can do the appointment over the phone. And we've done at this point hundreds of phone appointments, for example, as well as virtual appointments. And so, you know, it's reduced travel drastically for both who we serve and our staff. And so we've even created partnerships in rural areas for people who, you know, for example, don't have access to technology or in some cases don't even have a phone. We've partnered with locations in their communities to say, okay, I understand if you don't want to do an appointment online, how about you meet me, you know, at the local community center and we can still do the appointment. So we've been able to have some pretty good success with switching to a more virtual format in order to do our appointments. And then the other thing I'll add was to that last program that the director talked about with our tribal connectivity project. We're just really excited about that one. That one came when we were talking to some of our tribal partners, and they were doing a lot of going back and forth with us, with the clients that they served, going back and forth to people's houses, for example, going back and forth between different government offices trying to access benefits for people. And they were just telling us how long it was taking in order to do things via paper on the reservations, trying to access benefits. And so the conversation really started. We said, if we gave you a laptop, for example, could we chop down some of the back and forth for you? Could we help you better serve your clients? And the answer was a resounding yes. So now instead of somebody taking paper and going back and forth with clients, we'll be able to just say, take this laptop, take this tablet. And we even started working with cell providers to see how far into some of Arizona's reservations could we get cell service? And that will then, equip both our staff and our tribal partners to say, okay, this is how far deep in we can go. Here's how far we have capabilities. And the tribes are also doing a good job of figuring out how to expand it also. So we're able to work with them to say, here's the places that we can have great cell service. And again, it just helps bring benefits and resources closer to the clients that we serve. So now instead of having to do a lot of back and forth, with paper documents, we'll be able to, hand out laptops and tablets, and in some cases, we'll be able to send out Wi-Fi hotspots in order to take care of some of those needs.
Thank you. I was also, you have a question here that I wanted to present to you. The question is, what barriers have been experienced and overcome with telehealth and technology interventions in tribal and rural communities? And I think you did, touch on this, with the papers. Is there anything more that you can say? What other barriers? I mean, as far as having access to the internet, was that considered a barrier, and how have you overcome that?
Yes, that's been a big one because in some situations we have staff who are also in those areas, as well as the clients that we've served. So we get creative. So access to internet is definitely a big one. And that's why I talk about, number one, having those good conversations with cell providers. So a few months ago, we actually started mapping out with some of our cell providers, what areas can you cover? How far into some of the rural areas of Arizona can you go in order to get us cell service? And even with our employees who work in those areas who don't have internet technology or internet capability in their area, what's the closest that you can go? And that's also why we tie in the transportation projects because sometimes it takes both of those projects in order for us to get it done. So for example, if you're in a rural area, you don't have access to internet, maybe it's getting you, that transportation service to somewhere that you need to go. So we really see transportation and technology really as going hand in hand because generally if you have internet capability issue, chances are we have a transportation one also. And we all know that there's a lack of public transportation and transportation services in those rural areas. And so we really have to tackle both of those issues at one. So one of the barriers is, like I said, access to internet. But the other thing is a lot of people in rural areas, they have no desire to access the internet. And we've seen a lot of that where people say, I will not do a virtual appointment. How do I see you in person? And so that's where we get those itinerant sites that come into play. That's where we say, all right, well, we'll meet you at the local library. We'll meet at a community center in order to get around that. But for the most part, the biggest barrier has been the access to internet, which is why we've tried to get creative also with phone appointments. And so we realized for the most part, outside of getting like a signature for something, we can do most things over the phone. So it takes a little longer for our staff. But we're still able to sit down over an hour or so and still get the things that we need from the client in order to still do the appointments over the phone. But then the only barrier from there is for the things that we need signatures on, we still have to do mailing in order to get those signatures on, unless we can get them to a place where they're willing and able to finish out the process virtually.
Thank you. So it's the technology and the transportation and understanding the person's needs and where you can help them. That's true health equity. So in terms of this initiative, this is part of the Arizona Department of Health Services Health Improvement Program. Is there anything else that you wanted to talk about regarding that program and strategies or anything that we haven't touched on so far?
Well, we're just really excited about it. We're going to try a few different things and just see what works. We are expecting, as we go deeper into the program, to have more barriers, right? So, as far as we know, the only one we've attacked is, being able to have internet capabilities in all areas of the state. But as
That's
we go
huge.
deeper, I'm sure we'll find more, and we'll try to be responsive to those needs as we get to them.
That's huge. Thank you so much. Are there any links that we can share regarding this whole initiative?
So not just yet. We're still in very early processes. So perhaps in the next few months, we'll have some good news to share, but we're still very early on.
Okay. So there's another question that I want to present to you. Since the process can take a while, what types of support do recipients receive while they wait for the services?
That's a great question. So the good thing about the way Arizona's veteran community is set up is we've really built an ecosystem to take care of needs. So generally, what happens when someone engages with us to do, no matter what the program is. So let's just say it's accessing VA benefits. So as we work on that, we're always going to be working on any other social determinants of health that are happening. So for example, if that person also needs financial assistance. Maybe they have a housing problem. Maybe they need to enroll in healthcare. Whatever those other things are, we'll attack them at the same time. So sometimes it can be a referral to an internal department, and like I said, we already have the person's information, so different departments within our agency can work on it at the same time. But let's say, for example, it's something that we can't do internally. That's where we look at our Be Connected team. So we'll make a warm handoff directly to our Be Connected team, and we'll give them the notes and say, these are all the things that this client needs. And sometimes it is, we put in for a claim, but we know that process is probably going to take 6 to 8 months for them to see anything come of it. What can we do in that 6 to 8 months? So we'll make that warm handoff, and we'll start working with that team to figure out what can we do in the meantime. So if it's, my utilities are being cut off, then it's let's find some utility assistance. Maybe it's that they need a part-time job or something. Let's work with our employment partners to do that. So I really try to keep people in the ecosystem during the entire process and after to make sure we're taking care of those extra needs.
Wow, that's really extensive. People think that they might just be able to do an intervention, just providing the internet service, but really you got to look at, have a really good understanding of the needs, from social determinants of health to, financial needs and everything working together, and have the system, like you mentioned, the ecosystem to support that. You have a great program, great support, and it's available, for, yes, of course, our veterans, but you're doing statewide work in the rural and tribal areas as well. So thank you so much. Are there any other questions? Okay. Well, thank you. I appreciate the recording that Colonel Wright provided in terms of providing us context, showing us all the systems that work together, and then you tying it all together with the work that you're doing around technology in rural and tribal communities. Thank you so much. And our next session will start at, let me just double check, at 10:15. This will be the panel discussion, what's impacting LGBTQ plus youth mental health. Thank you all, and see you in about 10 minutes. Thank you, Nicole.